We are live. Okay. Welcome, everyone. And I'm so glad for today's session. So, welcome to our Tuesday Total Wellness. For those of you who are meeting me for the first time, I'm Dr. Shobha Rayapudi. I'm the co founder of Gift of Health, and I actually help people struggling with high blood pressure, high cholesterol, diabetes, and other chronic conditions that we see nowadays to break free from those diseases, reduce their dependency on medications, and have more energy. So I'm very excited today because I have a special guest. We think of our body, I know, like we think of our heart, we think of our kidneys, we think about our gut, but sometimes we forget that we have our precious eyes. And sometimes even we forget that it is a part of our body, and like what we do, like what we eat and our lifestyle does affect those eyes as well. So I'm really excited to have a very special guest today, Dr. Shilpi Pradhan, and it's a huge honor and a pleasure for me to introduce her to you guys. So Dr. Shilpi Pradhan, she's both certified ophthalmologist and she's also both certified lifestyle medicine doctor. She's a mother of 4 beautiful children. And let me tell you, she is also like very interested in personal finance and real estate enthusiast. So her interest, I mean, she is interested in the impact lifestyle medicine can make on eye diseases and overall health. She went to Emory University for college and Washington University for medical school. And she got her residency in ophthalmology at Medical College of Virginia in Richmond. And then she also further did her fellowship in cornea, external disease and refractive surgery fellowship at University of Pittsburgh Medical Center in Philadelphia. So she has been also an assistant professor at St. Louis University in St. Louis, Missouri, and loved teaching residents before moving to Virginia. So right now she owns a solo practice, which is called Eye Doctor MD in Glen Ellen, Virginia since 2015, and practices ophthalmology with lifestyle medicine education for her patients. She also completed her plant-based nutrition certificate from eCornell, and she also helped her children publish their books on Amazon, including Tara the Dolphin and Summer Fun, Unmasked by Shreya, Pebble the Penguin by Ankit, and Ocean ABC by Shreya, Ankit, and herself. So, welcome, Shilpi, and it's really a huge pleasure to have you here.
Thank you, Shobha. This is an honor for me as well. I love talking about eyes and lifestyle medicine. It's definitely changed my life and the lives of a lot of my patients because I practice medicine differently with a different focus now. I can share examples. I have a talk prepared for you all so that we can go through it in a systematic manner, but just a recent example I can share where lifestyle medicine made a huge impact just to inspire you as we get started. I had a 60-year-old patient who came in with double vision, had been admitted to the hospital and discharged and referred to me. He had a 6 nerve palsy from diabetes. Diabetes can cause kind of like a mini stroke in the eye muscles as well. So his brain was fine. It was just the nerve that went to one of his eye muscles causing double vision. He was very depressed and sad about it. And we talked about lifestyle medicine. We talked about, you can get your diabetes under control. This is reversible. Your body can heal itself. And he has gone on, he's amazing. He's gone on to lose 50 pounds over the next 4 months. He's 6 months out now from that episode. And of course, his double vision went away within 3 weeks. His motility and eye movement came back to normal. And he's doing great. And he gave up like all the things that we talked about. He just was like, okay, you're telling me what to do, even though I'm an eye doctor. He's like, I'm going to get this under control. I cannot live with this double vision. So it's just so much that we can learn from lifestyle medicine. I'm learning so much every day. And I just love to teach patients and give them the power to change their lives with just diet and exercise and working with their regular doctors to get things back under control. Because there's no medicine that could have helped cure what he had. No surgery either that could have helped get rid of his double vision. You're muted.
Wow, that is so inspiring, Shilpi. So, like as you said, like there is no medicine like better than like changing our diet and lifestyle, and that is such a powerful thing to do for us. So, I know. I know I won't hold you further back because I know like you have a beautiful presentation prepared for us. So we are curious to know that like what we can do about our eyes and like what are the major causes of blindness and like how we can take care of it. Like is it possible to prevent, or even let's say if we have it, to halt the progression or do anything about it? So we are really excited to learn all these things today. So I will let you go ahead and share your presentation, and the floor is yours.
Great, thank you. I'm going to go ahead and start sharing my screen. And I did want to focus on what you mentioned, the major causes of blindness, because nobody wants to go blind. So,
Yes.
and we're going to do a lifestyle medicine focus. Let me see here if I can advance my slides. So you already know all about me. Dr. Shobha told you a little bit. I also have 2 books that do talk about lifestyle medicine, How Healers Heal. But we can talk about those later, which talks about my story, and I'll share that more at the end. But let's get into eyes. So what we're going to talk about today, we're going to talk about basic eye health, and then the major issues that worry us as we get older: glaucoma, cataracts, diabetes and diabetic retinopathy, macular degeneration, and then dry eye, which is a huge focus of my practice. So they are the 4 leading causes of blindness. Glaucoma is the #1 cause of irreversible blindness in the world, in any part of the world. And we're going to talk about what is glaucoma and what we can do for lifestyle medicine changes to impact that. Cataracts is the #1 cause of reversible blindness in the world. So of course there's cataract surgery, which is the most common surgery done in the world, actually. But before you have cataract surgery, what can we do to prevent it through lifestyle changes? Diabetic retinopathy, which in diabetics, there's a whole grading scale of diabetic retinopathy, but we're gonna talk a little bit about that. And then macular edema is the #1 cause of vision loss in a diabetic for centrally that can impact quality of life. And then macular degeneration is the #1 cause of central vision loss in older adults as well. So we're going to talk about that. And for ophthalmology, which is really amazing, we are standing on the shoulders of giants, all of us, right? We're learning from all these decades and decades of research, people well ahead of their times, studying how diet and exercise impact the eyes. So none of the research I'm going to talk about is mine, because all of these amazing researchers, put their time, energy, effort into studying these. I'm just presenting some information for you, hopefully in a easily accessible manner. Dr. Shobha wanted me to go through the anatomy of the human eye a little bit, just so everyone's on the same page of what exactly is your eyeball and what parts are we talking about. So this is kind of like a side cut of the eyeball. And I'm going to just look at my timer so I don't spend too much time on every slide. Okay, there we go. So this is the eyelids and eye muscles. That's where I was talking about for that one patient. One of his eye muscles had been affected. Inside or on the surface, there is the cornea. That's the clear part where you would wear, if you wear contact lenses, the cornea is where the contact sits. And then there's the colored part, the iris there, and then the opening is your pupil. And behind it is the lens. The lens is what gets cloudy in cataracts. And then you've got the jelly that fills your eye. It's clear, you can't see it. And this orange part with all these blood vessels is the retina. That's the film of the camera of the eye that helps you see. where diabetic retinopathy affects. The central part of the retina is called the macula. That's where macular degeneration affects. And then all of the retinal fibers collect up into a cable to the brain, and that's the optic nerve. All right. We're going to go on to glaucoma. I think people are confused about glaucoma, what exactly it is. Back in the 80s, 90s, and before, it was always thought that if your eye pressure was too high, then you had glaucoma. And if your eye pressure was normal, then you did not have glaucoma. That's not exactly true. So glaucoma is actually an optic neuropathy. So the nerve in the back of the eye, back here, being damaged by pressure that's too high for you. So now we know it's all dependent on the nerve. We knew that before as well, but another example, if you think about the nerve as a cord from a television to the socket, the pressure is like a pair of pliers squeezing that nerve. And as it damages those fibers, you lose your vision from the outside in. So you really don't notice it until it's advanced. And we don't want to catch it when it's advanced. We want to catch it when it's early and mild and prevent you from ever losing vision. And everybody's nerve is different. Some people have a really soft, squishy nerve, and a tiny bit of pressure, even a normal pressure of like 15, 16 can cause damage. And some people have a really resistant pressure. I say sometimes like a casing around their nerves, which is not true, it's just my analogy, that helps protect their nerves. And even a pressure of 25 can do no damage. So we're looking at the nerve more now than the pressure, although pressure is still important. And this is an OCT. This is kind of gold standard for the last 20 plus years of looking at glaucoma. And here's the nerve again. And we're measuring where this green circle is, kind of a cross section through the nerve fibers. And then we open it up as a line. I don't know if you can see my arrow. Here's the line. So here's the nerve fiber layer that goes from your eyeball to the brain between that red and blue line. And we plot it on a graph of the thickness of that layer on the y-axis and the location around the nerve on the x-axis. And this is actually my OCT from 2017. And you can see I'm nice and healthy, which is great. And we've got, quantitative numbers that we can follow, whether your nerve is thinning out over time, if it's being damaged. And we're going to talk about the lifestyle factors that affect glaucoma in just a moment. All right, and this is one of those other type of tests that we do. This is not as important as an OCT nowadays because that's more objective evidence. This is more subjective, where you're looking at the little, you may have sat in these bowls where you push these little buttons where you see flashing lights. So this is plotting out if you've had any damage into your central 30 degrees. So this won't catch it early. The other test will. Okay, any questions on glaucoma before I move on to just describing the other diseases quickly, and then we'll move on to the lifestyle factors? No.
So you're good, Shilpi. Just go ahead. Yeah. Like I do have questions, but I'll ask you at the end.
Okay, great. So cataracts, again, as I discussed, the cataract, the lens is, if you can see my arrow, is behind the iris. And so if once it gets cloudy, sometimes in third world cataracts, you can see kind of like a whitening inside the pupil here. This is a really mature white cataract down here. This is what we call a brunescent or brown cataract. So over here, as the light is blocked by the cataract, then your vision declines. And again, I love doing cataract surgery, and so do all of us, but can we prevent it before it gets to a surgical stage? And we're going to talk about that. Diabetic retinopathy, these are just some pictures of the retina, the macula in particular. So with damage, the way I talk about diabetes is, you all know your blood sugar is high, and we can talk, I'm not going to talk about the pathophysiology of it, but in the eye, it's so amazing because it's the only place in the body we can see actual nerves and blood vessels, and these thicker vessels are the veins and the skinnier ones are the arteries. But what diabetes does is it acts like a little knife poking holes in those vessels with the high blood sugars. And as it pokes those holes, we see bleeding and swelling, and we can also see leaking of the cholesterol from those blood vessels. Look at all this yellow stuff here. This is actually leaked cholesterol from blood vessels into the retina. And then the cholesterol acts like a sponge and pulls in more and more fluid. And so down here is this OCT image cross-section, and you can see all this fluid kind of building up. Just like a camera, if the film is wet, it's not going to see very well. So And as you progress, you're going to lose more vision. The eye actually feels like it's starving for oxygen because there's so much blood and so much fluid over time as diabetic retinopathy progresses. But luckily, our bodies are amazing. It's reversible as you control your diabetes. So there's so much hope. This can all be reversed without medication, with you controlling your diabetes. Okay, moving on briefly to macular degeneration. Again, the macula is the central part of the retina. You have dry macular degeneration and wet macular degeneration. There's also another type called geographic, and we can talk about that. The way I explain this one is the retina is like a cake, and then there's the blood-brain barrier underneath it. It's the plate that the cake is holding on, is held on rather. And then the retina actually regenerates every night while you're sleeping, which is really cool, the photoreceptors. And if they don't regenerate properly, if they don't have the right nutrients, they form these little breakdown products that we call drusen when we look at them. And as they become more and more drusen, that plate under the retina kind of starts breaking. And when it cracks, the blood vessels underneath that blood-brain barrier can go through the blood-brain barrier and disrupt the retina, kind of like a mini volcano into the retina. So that's wet macular degeneration. Once you get to that stage, there's still things we can do, but we'll talk more about lifestyle factors in just a moment. You may have seen this kind of test. This is a grid test that if you have macular degeneration, your eye doctor may have given you to check. So once you get to that volcano stage with bleeding, the way you do this test is you look at the center dot on a paper with your reading glasses and make sure all the lines are straight. If they start becoming wavy or distorted or missing, that means you probably have some fluid or bleeding inside your retina. You need to get in to see your eye doctor. Okay. And then here is another example of this amazing test called the OCT. You can see the retina here, and then these bumps are those drusen that are kind of developing under the retina. And here on the right side, you can see they've broken through and you've got bleeding under the retina and inside the retina. So that's converting from the dry to the wet macular degeneration. Phew. Okay, now that was our quick overview of eyeballs, and then we're going to talk about the pillars of lifestyle medicine and how do they affect these 4 leading causes of blindness. So there's a lot more that I need to do research on. That's why some of these are blank, but what I have looked at, and we'll look at some more. Glaucoma, does nutrition affect it? Yes. And it can help decrease your risk of progression or decrease development. Does physical activity affect it? Yes. And we're going to go through these in a little bit more detail. Smoking, yes. Alcohol, yes. Sleep, yes. Social connection and stress, unknown for glaucoma. Cataracts, nutrition definitely affects it. Physical activity, not sure. Smoking, most likely, but not sure. And alcohol, sleep, and social connection, I have not looked at enough yet. Diabetic retinopathy, nutrition, of course. So nutrition affects diabetes. It definitely affects diabetic retinopathy. Am I talking too fast? Am I good?
You're good. You're good,
Okay.
Shilpi. Yeah.
Okay. Physical activity, of course, affects diabetes, and so it affects diabetic retinopathy. Smoking, yes. Alcohol, yes. Sleep and social connection, I don't know about for diabetic retinopathy yet. And then macular degeneration, nutrition, yes. Smoking, yes. And the other 4 pillars I have to look at in more detail. But let's look at these a little bit more detailed now for glaucoma. So I was actually surprised to see some of this research because I was not expecting it. I was not expecting that a healthy BMI would decrease your risk of glaucoma, but it does, which is pretty darn amazing. Eating green leafy vegetables, this is well known in the ophthalmology community, but eating green leafy vegetables increases blood flow to the optic nerve, and so it's thought to help decrease the risk of glaucoma. So the optic nerve is almost kind of like a watershed zone where there's a constriction of blood flow because of where the opening in the back of the eye is, the white part of the eye, as all the fibers kind of exit out. So sometimes, and we'll talk about that more for a few other things, some patients have even small openings, and they're at higher risk for stroke. I'm going to go on a tangent. Unrelated to glaucoma, there's something called non-arteritic ischemic optic neuropathy, where you can get kind of a stroke in the optic nerve, and those patients have what we call a disc at risk, really small opening. And so that blood flow is cut off really easily. So eating green leafy vegetables helps decrease that risk as well. And we're not going to get into that too much more, but I was surprised to learn this too. Higher doses of calcium, potassium, magnesium, especially through food and whole food plant-based diet, in non-hypertensive patients can be protective against glaucoma because the nitrates in those foods help the blood flow to the nerve. Which is pretty amazing. Dr. Shobha knows more about which foods, but I've got a few listed: kale, spinach, collard greens, sweet potatoes, avocados, and squash all have really good amounts of calcium, potassium, and magnesium. And other fruits and veggies that were shown to help decrease the risk of glaucoma, which was so interesting to me: peaches and then carrots in women. So carrots we think of as helping our photoreceptors, our rods and cones, but it also can help the optic nerve, which is really cool. Any comments on these foods, Dr. Shobha?
We are good. Yeah.
Okay. And this one was also surprising to me. I did not know omega-3s help decrease the risk of glaucoma. I mean, I love omega-3s, in food sources, and supplements too, but we're going to stick to whole foods. But especially for dry eye, because that's a big passion of mine, but I did not know that it would help glaucoma, but it does. Eating more omega-3s is thought to help decrease your risk of glaucoma. Eating vitamin B3 is thought to decrease your risk of glaucoma as well. So things that have vitamin B3, I've got this little chart on the right side: peanuts, avocados, mushrooms, brown rice, and green peas. These are all good for your eyes. I'm sure you love them anyway. And higher doses of antioxidants were associated with a decreased risk of glaucoma, specifically vitamin A, C, E, zinc, selenium, and magnesium, which is so cool. So as you're eating healthy, you're decreasing your risk of glaucoma as well. Okay, specific foods for sometimes increasing risk. Coffee, sometimes thought to increase your eye pressure by increasing the fluid production, and possibly with some dehydration. Some association in multiple studies with worse glaucoma, but not like a causation. Tea, however, was thought to be protective by reducing the oxidative stress with flavonoids, at least 1 cup of tea per day, which is interesting. So if you're into coffee or tea, tea is better than coffee for glaucoma. Dark chocolate was thought to help decrease the oxidative stress in normal patients. And then it helps produce nitric oxide, which is NO abbreviated, which can also help kind of open up those blood vessels and help protect against glaucoma. Just so interesting. And of course, nitric oxide can help with heart disease and peripheral artery disease. So not too much, a little bit, as you know. Specific foods and glaucoma. This is interesting because patients sometimes want to take supplements for glaucoma, and of course, we want to focus on whole food, plant-based. Ginkgo biloba is a supplement that's kind of thrown around for glaucoma. I don't really support it. I don't tell my patients to take it, but there is some studies showing that it increases blood flow and helps protect against it. You definitely cannot take it raw. It does have risk of bleeding disorders. It has risk to your heart as well. So please don't take supplements with ginkgo without talking to your doctor. One study actually showed saffron can lower your IOP as well, and vitamin C can help decrease your risk of developing glaucoma. I've got another diagram on the right showing foods rich in vitamin C, which you all know. There's gooseberry, amla, oranges, bell peppers, cantaloupe, kiwi. One missing on this chart is strawberries, which have a good amount of vitamin C too. Any other ones missing on this chart, Dr. Shobha?
This is a good list, Shilpi.
All right. We're going to keep going. So smoking is a huge, huge thing. So it is one of the #1 risk factors other than aging and genetics for causing glaucoma. So if you're a smoker, please quit. Please get the help you need to quit. It doesn't affect your eye pressure, but it definitely increases oxidative damage, decreases blood flow to your optic nerve. And quitting smoking, if you have glaucoma, can also decrease the progression, but it is a huge risk factor for causing glaucoma as well. Same for macular degeneration, huge risk factor for causing macular degeneration other than aging and genetics, family history. Okay. If someone has glaucoma, I always get asked about this. Oops, let me go back. MJ is short for marijuana. So I don't recommend marijuana for glaucoma. Has been shown to help decrease your eye pressure, but it is not effective for a long-term glaucoma treatment. The effects only last 4 hours, and your eyes actually become resistant to it over months. So then it has no effect. It is not worth using for your eyes and for glaucoma. The American Academy of Ophthalmology also put out a statement when CBD and CBD gummies were being used commonly by a lot of people, that CBD can actually make glaucoma worse, even though the THC and marijuana can help. But of course, our stance is not to use that for glaucoma at all. Same for alcohol. Alcohol possibly lowers the pressure due to pulling water out of your eye and decreasing the pressure that way, but it is not a treatment for glaucoma, please. And the effect only lasts 65 minutes. So that's definitely not worth harming the rest of your body for glaucoma. We have many effective treatments. This is not one of them. Illegal drugs, cocaine can also increase your risk of glaucoma, especially in men, 3 to 4 times higher risk. And you can develop glaucoma much, much younger than if you did not use cocaine. I'm sure your audience is not doing any illegal drugs, but if there's anyone that needs convincing that, your vision can be severely affected by these drugs. Okay, physical activity can also help decrease the risk of glaucoma, which is great. 2 cautions, however. Glaucoma has been found to be worse in patients who are doing inversion kind of therapy or headstands, because increasing the blood flow to the head actually increases the risk. It's like over congestion of the optic nerve and increases the risk of your glaucoma progressing. This is so only if you already have glaucoma. I don't think there's an association if you don't have glaucoma. So if you already have glaucoma, don't do headstands or inversion therapy or hot yoga. Sleep, this is also somewhat related. We know that glaucoma is worse on the side that you sleep on, so it's better to sleep on your back. It's better to sleep with your head elevated. So same kind of principles as doing headstands, and then if you have sleep apnea, it definitely makes your glaucoma worse. And treating the sleep apnea with however you want to medicate, the CPAP machine, of course, but with lifestyle choices, if you can lower your dependency, lower your weight, improve your health, and lower your dependency on CPAP, that can also help your glaucoma. But if you need it, please use it, and please talk to your doctor as well. All right, that is my quick summary on lifestyle medicine and glaucoma. Any questions on that before we move on?
No, you're good, Shilpi. Go ahead.
Okay. Cataracts. So cataracts are so interesting. This is kind of a diagram of the lens inside the eye, the front of the lens, the back of the lens. So as you get older, there's the meat of the cataract, the nucleus actually gets darker and more opaque. But the anterior and posterior parts of the lens get more opaque, more commonly with steroid use and with diabetes. So depending on the type of cataract you have, I can tell what's going on with the rest of your eyes. Sometimes people are surprised, like one type of cataract is not the same as all types of cataracts. We're going to talk a little bit more about that, but I've seen patients with improved dietary changes, including my dad, who had mild cataracts, and as he improved his diet to a more whole food plant-based diet, the nuclear cataracts got better. And if I hadn't seen it myself, I would think that person was making it up, because in our textbooks, it does not say that cataracts can get better with diet changes. But I've seen it myself, and vision has improved. So anyway, so let's talk more details. Cataracts are associated with lifestyle diseases. So we already mentioned that: diabetes, the anterior and posterior, high blood pressure and obesity, of course, and chronic kidney disease and autoimmune diseases. Autoimmune diseases cause inflammation inside the eye, which can necessitate you needing more steroids, which can cause cataracts as well. There is also an association with UV exposure. This I found really interesting. I did not know this until I was researching for this talk the first time I gave it, that vitamin C and vitamin C foods can help delay the progression of cataracts. And that's one thing my dad also did. He started, really focusing on his vitamin C, and especially in patients after vitrectomy surgery. We're going to talk about that a little bit more later. But all of these supplements, or not supplements, foods that you want to help give your eye can help decrease the risk of the onset of glaucoma, including carotenoids, the lutein and zeaxanthin, beta carotene, which are on all those good vegetables we talked about. Kale is the highest for lutein and zeaxanthin, and then vitamin C. We just mentioned those list of foods with vitamin C, vitamin E, and taurine can help delay the onset of cataracts. Niacin, or B3, we talked about for glaucoma, can also help decrease the progression of cataracts. And deficiency of those has been linked to cataracts progressing, which is so interesting. Again, I listed the foods with the high carotenoids. Kale is the biggest, spinach, orange bell peppers, tomatoes, broccoli. And I can't see my last one. Oops.
It's carrots.
Okay, carrots. There it is. Blocked by my little info bar. Okay, next. And tomatoes. I love tomatoes. Okay. So this was a really interesting study when I was looking at it. So the vitreous is the jelly inside of the back of the eye. And you can see different types of cataracts here. Diabetic cataracts also can occur in the back of the lens, as well as in the cortex of the lens, around the lens. Diabetic cataracts are so interesting. They've developed over many 20 years ago when I was a medical student. They had a mouse model of diabetic cataracts and how they can kind of knock out certain genes and induce these cataracts. And then they weren't studying diet in mice to help decrease the progression. But, it's a clearly linked how these things progress. So in this diagram, this was a study that showed that patients who had their vitreous removed, which we don't really know exactly what the purpose of the vitreous is once you're out of the uterus, once you're born. In utero, we know there is use for the vitreous, but there is a use because patients who have the vitreous removed do get cataracts much, much faster, especially a nuclear type. But this study looked at vitamin C levels, and the vitamin C levels in the eye are actually like much higher, and removing the vitreous decreases the vitamin C level in the eye, and that can contribute to cataract formation. So I was wondering if that's how my dad decreased his cataracts over time. Of course, everything in moderation, vitamin C in super high doses can be damaging to your body as well. Oh, I can't read the bottom of my slide. Okay. And then you don't want to supplement, try to get it through the whole food plant-based approach as well. And you don't want to go more than 1 gram per day if you are supplementing. Okay, let's keep going. But I thought this was very interesting. Who thought to study this? All right, I think that's all I've got on cataracts and diet. Any questions on that?
So people did have questions on cataract. So Connie is asking, I just found out that I have cataract developing. What can I do to reverse or halt the progression? I know like you did talk about some of the things here. You did talk about the dietary. So anything else you would like to add to this question, Dr. Shilpi?
Yeah, so I would say if you're a smoker, quit smoking. I'm sure that one's obvious, but wearing UV sunglasses outside can also be somewhat protective. The UV link with cataracts is not super definitive, but I do think there is a link, and protecting your eyes with sunglasses with 100% UVA and UVB protection is important. And then the vitamin C, which I was actually really shocked to see that study. And again, in my dad, I would eat more high vitamin C foods. Don't supplement. If you are taking supplements, no more than 1,000 milligrams or 1 gram per day.
Excellent. Excellent. So Mary is saying, I had cataract surgery on both eyes at my 5-week checkup. The doctor said I had scarring and see in 6 months to see if I need laser treatment. Is there anything I can do to heal this scarring?
That's a great question. No, I'm just gonna I'm gonna reverse to this slide here. So the scarring is interesting after surgery. So I'll just talk about surgery briefly. So the cataract is like a little M&M, I describe it. And what we're doing when we do surgery, we're opening up the front capsule and we're taking out all that chocolatey cataract, and then we're polishing that back capsule and putting the implant right in that same capsule. That's what holds it in place. It's pretty an amazing surgery. So what happens is sometimes there's just cells left over. I mean, we can't get 100% of the cells, right? Sometimes they go crazy and they just start growing in the back capsule. And sometimes they stop, and there's nothing you can really do to make them stop that I know of. I mean, maybe it's similar to the lifestyle medicine factors that we've already talked about. But if they start growing across the capsule so much that it blurs your vision, there's a pretty easy solution, and that's the laser that your doctor mentioned. And we would just laser the capsule open once the lens is safely and securely healed into position. The lens design, depending on what lens implant you got, which is standard of care, those back in the 90s, like 100% of them would get scar tissue, and you would have to actually have a second surgery to go in and remove the scar tissue. But nowadays we can treat it with the laser, which is amazing, and the lens design has changed a lot to improve the risk of that growth. But as far as lifestyle factors, because it's such an easy fix, I know it's a lot to go through to have a surgery and then have laser, but I'm not sure anyone's going to study it from a lifestyle standpoint. But some of the things that we already talked about hopefully could help, but nothing that's been studied. But I can, you know what, I'll write that down to look into that as well, because that's a very interesting question. Let's see here. Um, Okay, and we call that posterior capsular opacification, or PCO for short, I'm sure, but or scar tissue behind the lens. But okay, that was my quick divergent into that. Anything else?
That's good for cataract. I do have questions related to macular degeneration. So I think next you're about to cover about diabetic retinopathy.
Yeah.
We can, yeah.
So I shared that inspiring story of my patient in the beginning, and that was not diabetic retinopathy, but it was another side effect of diabetes. And we all know that nutrition is huge in helping even reverse diabetes and diabetic retinopathy, which is amazing. I mean, we were not taught, I was not taught in medical school that diabetes is reversible, but through lifestyle medicine and my board certification, I've learned that it's reversible, which is just amazing. So diabetic retinopathy is also reversible to a point. Once you get to severe or proliferative diabetic retinopathy, I'm not sure it's reversible, but that's pretty advanced. And if you're at mild or moderate, you can definitely reverse it. Regular BMI, normal waist circumference, is associated with a lower risk of diabetes, as you all know. You know that diet sodas and high calories, rice, choline, those all increase your risk of diabetic retinopathy. High sodium intake increases your risk of diabetes progressing in your eyes. Just so interesting. Okay, let me move on. So all the things that you would do for your diabetes, you want to do for your diabetic retinopathy. Eat your whole foods, your fruits, your veggies, your fiber, your omegas, they all protect against diabetic retinopathy. If you're regulating the blood sugars in your body, you're regulating your eyes. One thing that I mentioned earlier, right? Your regular doctor wants to have an eye exam once a year because we can see those blood vessels and any damage. But one other kind of side note is, if there's bleeding going on in your eyes, in your retina, if there's cholesterol depositing, guess what? That microvasculopathy that's happening in your eyes is happening in your heart, it's happening in your kidneys, it's happening in your liver. So it's actually a marker for everything that's happening in the rest of your body. So if you can reverse diabetic retinopathy and eye disease, you're reversing it throughout the rest of your body as well, which is pretty darn amazing. Our bodies can heal if we give them the right tools. So lutein, which is a big one in kale and helps for macular degeneration, also has protective effects against diabetic retinopathy. Vitamin C, another one that we've talked about for cataracts, also has protective effects against diabetic retinopathy, which is pretty amazing. No evidence on vitamin E or D, and then healthy lifestyle risk reduces your risk of diabetic retinopathy by 30% if you can meet all those criteria, which Dr. Shobha is teaching you guys to help control. And low alcohol consumption, of course, non-smoking. Let's see. So interestingly, stress and depression is more prevalent in patients with moderate or severe diabetic retinopathy, maybe because they're not seeing as well. One side note, going back to cataracts, which I think was recently in JAMA again, but it's been well known for 15, 20 years. But as patients get older and develop cataracts, their vision is so impaired that it actually increases the risk of dementia. And I've seen it in my patients, some older patients who come in kind of scared. And once you take out the cataract and do the cataract surgery, their whole world kind of brightens up. So maybe similar in this case, there's no like correlation causation, but it's just more prevalent in depression being more prevalent in patients with diabetic retinopathy as it's getting more advanced. Okay, that's all I got for you on that. Physical activity is kind of a given with helping your diet and your diabetes, but I did not find anything specifically for that for diabetic retinopathy.
Yeah.
All right, I'm going to move on to macular degeneration.
Yes, because we have a lot of questions on macular degeneration. So yes.
Yeah, so nutrition is huge because when you have dry macular degeneration, the biggest thing we can do is give your body what it needs to regenerate those photoreceptors every night while it's repairing itself. And the age-related eye disease study, or AREDS for short, has been done twice, back, I think, in 2002 and 2012. The original study had vitamin C and E, and it had beta carotene, which was then found to cause an increased risk of lung cancer if you were a current smoker or had been a smoker in the last 15 years, which is huge. So beta carotene sometimes in that supplement was not good for people's lungs, and they were taking it for their eyes. But so they changed the formula around when the AREDS 2 study, and instead of beta carotene, they took that out and they put in the lutein and zeaxanthine, which is really important for the photoreceptors, and zinc and copper, which is helps those absorb. And that is the current recommended supplement for someone who has dry macular degeneration to make sure you're getting the right amounts. So if you have a family history of macular degeneration or any of those little yellow bumps in your retina, it might be good to take the vitamins. Otherwise, getting it through a whole food plant-based diet is enough. Let's see, the highest food with these nutrients, as I mentioned before, is kale. I love kale. Okay, so lutein is a carotenoid. It's found in fruits and vegetables. It's anti-inflammatory. I've got this list of foods here that have lutein and zeaxanthine and the milligrams per 100 milligrams of the food. We've got paprika, sweet potato leaves, dandelion, pepper, turnip greens, cress, spinach, chard, chicory. So all this kale, basil, parsley, collard greens, mustard greens, arugula, peas, lettuce, squash, and egg yolk as a very low amount, but it's on the list. So lutein is anti-inflammatory. So macular degeneration, the last 10 or more years, is actually thought to be an inflammatory disease as well. Because as those volcanoes kind of erupt through and into the retina, as I mentioned before, they create a lot of inflammation and release these vascular endothelial growth factors that can create more and more inflammation. So if we decrease inflammation in our bodies with these anti-inflammatory foods, we're going to help the eyes as well. Lutein, as I mentioned before, decreases the formation of cataracts as well. If you are deficient in iron, zinc, or protein, it can limit your absorption of the lutein through the food. So you may want to work with your primary care doctor and make sure your iron levels are okay. And that's why zinc is in the supplement to help the absorption of the lutein. And protein, we get enough protein from our veggies, but it is important to have enough so you can absorb the nutrients from your diet. Smoking and alcohol consumption does also inhibit its absorption into your body. So another reason to not smoke or drink alcohol, to get that lutein into your retina. Okay, I'm stuck. Let me go to my next. Okay, so non-eye benefits of lutein. These are just some of the supplements, and lutein is found in marigolds. So that's why there's a picture of marigolds, but it actually helps improve your cognition and memory as you get older. It has some association with a decreased risk of cancer. It also helps for heart disease and stroke. It lowers cholesterol. This I was surprised by. It improves lung function and bone formation. So it's a really good all-around thing for you. So eat more kale and can decrease your risk of preeclampsia in pregnancy. It helps your skin as well. All right, toxicity. Obviously, you don't want to take too much. So a safe amount on the bottom of the screen is listed 10 milligrams per day if you're supplementing, which is the amount in the AREDS 2 vitamins. It can cause orange skin, so don't take too much. It can increase your risk of lung cancer in smokers. And then there is this picture down here at the bottom of crystalline retinopathy. You can actually get these little crystals of lutein into your retina, which don't cause a visual effect. So the patient's vision is not affected, but you get these little sparkly crystals in your retina. It is reversible if you stop taking the extra lutein because your body loves to have homeostasis. Okay, let's do questions on macular degeneration.
Absolutely. So Joanne is asking, I'm whole food plant-based vegan, but now I have been diagnosed with wet macular degeneration and I am receiving injections. My question is, could my low-fat vegan diet have contributed to this? Should I include fish and eggs?
Oh, that's an interesting question. I don't think I can answer that without knowing more about you. Number one risk factor is smoking. The second would be aging, and the third would be genetics. So if you have a family history, I would say those are the three biggest risk factors. If you don't have any of those three risk factors, I don't know how old you are. In theory, if you were not properly maintaining like your protein intake and not taking a well-rounded whole food plant-based diet, I suppose. I mean, everybody's body is so different. I was going to talk about my gluten intolerance and celiac in a little bit, but I definitely know before I figured out that I was gluten intolerant, I was probably very deficient in a lot of nutrients because my gut, even though I was eating a good diet, I wasn't absorbing like a lot of the things because I've had so much diarrhea with my gluten intolerance. So I can't answer that question directly, but anything's possible. I'm sorry you're dealing with that, but importantly, it is important to take those supplements, the AREDS 2 supplements, because your biggest risk factor for wet macular degeneration in your good eye, the other eye is still the same. And I'd hate for you to have to get injections in both eyes. Although we are so fortunate, these injections that we have now are amazing and can work miracles and get all your vision back. Although I know they require sustained injections sometimes for months or years, depending on your level of disease.
Thank you. So I have one question from Bonnie. Okay, so Bonnie is saying, I have been diagnosed with dry macular degeneration. Within 10 years of my mother's diagnosis, she lost most of her vision. I will do anything to avoid progression. Can it be reversed? Or is the goal once diagnosed just to keep it stable?
It's a great question. So there's two main types of dry that I kind of skimmed over the second type. The second type is geographic atrophy, where in my example of the cake and the plate actually starts degenerating. That's a geographic atrophy type, and then the retina kind of degenerates with it. So for the main type with the little bumps, the drusen and the yellow deposits on the retina, I actually have seen that improve with the AREDS 2 vitamins and better diet, which is amazing. I don't think that's published, but I've seen it in my patients. And if you can maintain or decrease your breakdown products in your retina, you should not progress to wet. So and of course maintaining like a healthy diet and a healthy weight and not smoking and keeping your levels of those supplements that are found to be very useful and recommended by the NIH and the American Academy of Ophthalmology are very important for macular degeneration.
Yeah. So Bonnie is saying, yes, mine is drusen And Bonnie, as Dr. Shilpi has mentioned, so it's yeah, it's important, especially having like having an ideal BMI also helps. So like losing weight, that definitely helps. And so here, okay, so Mary is asking, my mother had macular degeneration, but when I was tested, I do not have it. Uh, Is there any specific foods I should focus on to prevent from having it?
Yeah, all the ones on this list, right?
Yes.
These
Yes.
ones.
Yes.
With the lutein and the zeaxanthin, and make sure you're getting things with zinc as well, which a lot of foods. Do you know which foods offhand have a lot of zinc?
Yes. So when it comes to zinc, particularly legumes, so beans, lentils, peas, peanuts, they are rich in zinc, and also your soy products, nuts, seeds, oats, they are all good sources of zinc. Yeah.
So I read a study a while ago, and I can't find it for the life of me, that said that 70% of patients over 70 are zinc deficient. So
Mm.
if you're zinc deficient, your GI tract cannot absorb all the nutrients in your foods. So it's really important to eat these foods that Dr. Shobha mentioned with zinc so that you can actually absorb the nutrients in the other foods that you're eating. And
Excellent.
zinc deficiency is also linked to dementia.
Mm. Yeah, good to know that. Yeah, it is scary. Um, so okay. Um, there was another question about okay, what are the foods that are rich in omega-3 so that like we can avoid the deficiency. So I will let you answer, Dr. Shilpi.
Okay, so for omega-3s, I tell my patients, especially when they have dry eye, which is my next section, but do I have an omega-3 one on here? I'll talk about that in a minute. But omega-3s, walnuts are rich in omega-3s, chia seeds, hemp seeds, those are really good in omega-3s, olive oil, of course. And then if you are eating any fish, then some of the fish sources are good in omega-3s.
Mhm. Yes, excellent. So, besides that, even leafy green vegetables or microalgae, they are a good source of omega-3s, and even like soybeans and soy products. And if you're not gluten sensitive, so even wheat germ, also it's a good source of omega-3. So these are all wonderful sources of omega-3.
Does nori have omega-3s, like the seaweed wraps?
So the they do say like especially when it comes to noreen, it is actually obviously it's rich in iodine, and it's also rich in iron. But I'm not sure about the omega-3 if that is rich in omega-3, but it is definitely rich in iron and iodine. Yeah.
My kids love that for a snack. So do I. Snack nori sheets that are now popular.
Yeah.
Okay, well, let me cover dry eye in the next like 2 minutes
Sure.
while we
Sure.
have some time. Dry eye is a passion of mine. I wrote this book called Goodbye Dry Eye, which is very easily accessible for patients in terms of solutions. But so nutrition wise, we want to add anti-inflammatory foods. Just like any inflammation, like macular degeneration, we talked about as now being thought of as a inflammatory disease. Dry eye also for the last 14 years has been thought about as a primarily inflammatory disease. So we want to add anti-inflammatory foods, berries, greens, omega-3s, remove pro-inflammatory food, processed food, dairy, meat. I want to just mention that a lot of times patients come for eye pain and they think it's due to their eyes, but it's actually due to sinus disease and referred pain to the eyes. And I have a lot of patients who have dairy as a cause of the sinus disease and the mucus intake. So going dairy-free can really help sinus disease. I have this one story of a patient who had thyroid eye disease and sinus disease. She even had sinus surgery to help her sinus pain and eye pain. And I was like, nothing helped her. She was still in pain. I told her to go dairy free. I said, please just try it for a month. Just see what happens. This is after living in pain for a year. And she tried it for a month and she's like, this is the first time I've been pain-free and inflammation-free and haven't needed to take antibiotics in a month. And she's doing great. So dairy can cause, referred eye pain as well. Flavonoid-rich foods that we've already talked about, leafy green vegetables, decrease the risk of mortality in the Blue Mountain Eye Study, which is an amazing study done in the 80s, which is looked at lifestyle factors and eye disease. And then hydration is a big one. A lot of times dry eye patients are not hydrating enough. So water is so important to our lives and bodies. Okay, let me keep going because I know we are really short on time. I wanted to mention sugar. Sugar is huge in dry eye. We have these little oil glands here. These are meibomian oil glands that live in the eyelid right behind the eyelashes. And they squirt out oil every time your eyelids touch and blink. And high sugar, blood sugars, and diabetics can actually cause the dysfunction of those oil glands. So then they're not producing the right type of oil, and then the ocular surface becomes more dry. 52.8% of diabetic patients had dry eye compared to 9.3% of normal patients in one control and one study, sorry. And then diabetics use double the amount of lubricating tears. So if you improve your blood sugars and diabetes, it can help dry eye too, which is pretty cool. Again, I mentioned a lot of these diseases are thought to be inflammatory. Dry eye is also thought to be inflammatory. It's linked with a lot of autoimmune diseases. 10 to 35% of rheumatoid arthritis patients have dry eye, 18% of psoriasis patients, 64% of sclerosis patients, 85% of thyroid patients, 21% of myasthenia patients. All these inflammatory diseases in your body are linked with dry eye, and women constitute the majority of patients with any autoimmune disease, and also the majority of patients with dry eye disease. Physical activity does help dry eye. There's not a whole lot that I could find, but one study showed office workers with a 10-week exercise program did improve their dry eye. And another study had a similar result, again, with office workers who are on the computer all the time. Sleep is a big one. I have patients who come in with dry eye who are sleeping with a CPAP. The air is chronically blowing on their eyes, and just wearing an eye mask can help your dry eye significantly. In the dry heat in the winter can cause dry eye by drying out your eyes. So a humidifier can help. Moving your bed from under a vent to over to somewhere else can help. Alcohol can make it harder for you to sleep. So if you do drink, then don't drink close to bedtime. And also electronic devices, if you need to turn them off at least 30 to 60 minutes before bed. I think there was another study that showed that it kind of like rewires your brain to be awake for almost 2 hours. I've had patients both with alcohol and with electronic device use who actually sleep with their eyes open, and then they come in the next morning with severe painful corneal erosions because their eyes completely dried off and the surface of their eye like sloughed off because their eyes weren't closed when they were sleeping. So sleep is super important to regulate your bedroom and make sure your eyes don't dry out. This is common sense, but I just wanted to share that there is published data that smoke vapors from smoking can irritate your eyes. Smoking delays corneal healing as well. It can exacerbate thyroid eye disease, which can cause like prominent growth of the eye muscles and prominent eyes, which is associated with dry eye. Also, sometimes patients can't close their eyes fully with that prominent, what we call exophthalmos, or prominent eyes. Another study, a meta-analysis, showed 50% higher risk for dry eye with smoking. Alcohol, we talked about for dehydration earlier, as it can pull the fluid out of your eye for glaucoma, but it can also cause dehydration for dry eye. It's also been found in the tear film. So if you're drinking, it can actually be absorbed into your tear film, and it can increase your risk of dry eye that way. Vitamin A deficiency is a risk with chronic alcoholism, which is associated with severe dry eye. It's also associated with night blindness. So if you're having trouble seeing in the night, or dark adapting, where you walk into a dark room and it takes your eyes more than 5 minutes to adjust to the light, then you could have vitamin A deficiency, something to talk to your doctor about. Okay, gluten, I mentioned briefly my story. I don't know how much time I have to get into it more, but gluten is definitely pro-inflammatory. Patients with celiac have flare-ups of dry eye. Patients with ankylosing spondylitis have flare-ups of uveitis, which is a term that means inflammation inside the eye of the uvea, which is the iris, ciliary body, and choroid. So, but basically, like gluten, if you're sensitive, don't take it, don't eat it, because it can cause so much havoc, not just to your GI tract, but to your eyes. Okay, so that's kind of my summary, kind of a whirlwind, but feel empowered to change your eye health and your life through lifestyle medicine and lifestyle changes and food and exercise and all the guidance that Dr. Shobha gives you as well.
This is such a wonderful presentation, Dr. Shilpi. It's really amazing. Like our audience really loved it. I know you have to get back to your beautiful children, so I wouldn't take much time away from you. So just one quick question. So Balwinder is asking, a thin layer of my retina is detached. Is it linked to any nutrient deficiency, or what might be causing it?
A thin layer. So retinal detachment is a huge topic. I don't know of any dietary or nutritional factors for retinal detachment. Now, when you say a thin layer is detached, does that mean you have like retinoschisis? What exactly does that mean? Do you have traction from vitreous macular adhesion or diabetes? There's so many. I'm sorry, I don't think I can answer that question without the details of what that means. Sorry.
Definitely. So Balwinder, like if you have more details, feel free to type in the chat, because it would be difficult to answer that question without having more details. So yeah. So everybody is thanking you, Dr. Shilpis. Sunita says many thanks, and Mary Ecoin says, okay, thank you so much. Very knowledgeable, very informative, enjoyed thoroughly. So thank you so much for your presentation and educating our audience. Like what a powerful role like nutrition and lifestyle plays on eye disease. We don't think about it. I know, like when it comes to other organs, we pay attention, or we put them together, but it doesn't occur to us that even like what we eat or what we do can affect our eyes. So this was so powerful. So thank you so much, Shilpi, and I know you have to get back. So I will let you get back.
Thank you
Um,
for having me. I love the sharing, and it's so fun for me learning as well, because lifestyle medicine has changed my life. Love to give back.
Thank you so much, Shilpi. Can you stop share okay, there you go. Thank you. Yes. So thank you so much. And we will see you. And as I said, I know I'll let you get back. Thank you so much for your time. We
Thank
really
you. Thanks
appreciate
for
it.
having me. Bye.
Thank you. Thank you. Bye.